discussion today by submitting a question online throughout the presentation. On the lower end of the bar on the left is chat. You go to that area and you can ask any questions by typing them in. We will take 5 to 10 minutes at the end of the presentation to go over questions. If your question is not addressed because there's too many and we run out of time, please email me and I'll personally respond to you. There is probably some things that will come up in our discussions today that are not in the PowerPoint, some additional information or documents. Please feel free to email me to request copies of anything that we discuss. This webinar will be available for replay for you to hear it again or to share with any colleagues. The library of webinars are listed with their links in the Best Performance Systems website, which is listed on this page. They will be mounted within several days when the recording is completed. There will be an education webinar similar to today's for each of the industries that Best Performance Systems works with. Let's get started. Malcolm Gladwell wrote a book called Outlier several years ago, and it's been a bestseller ever since he wrote it. Outliers, according to this book, are people that are different than the norm. Now, an outlier in general is not born that way. They have some situation and they put in some type of work which makes them an outlier. They're better than the norm. So who were some outliers? Bill Gates and Microsoft outliers. Microsoft changed the entire world with what they introduced in software and in the PC. It didn't happen by accident, and it wasn't dumb luck. Bill Gates, when he was in junior high school, was fascinated by these new things called computers, and he lived in walking distance from a university which had a computer lab. And he knew somebody who worked in the computer lab who allowed him to use it on the off hours. Bill Gates spent the entire night, 5 to 7 nights a week, working in the computer lab. He was dedicated to learning everything about the computer year in and year out. He was dedicated to working on the computer, and that's how he became an outlier. And that was what grew into Microsoft. The Beatles were outliers. They were a great musical group, but there's lots of great musical groups. What set them aside was the 3 years they spent in Hamburg, Germany. While there, they weren't playing in rock and roll clubs. They were playing in strip clubs, and they weren't playing 2-hour sets like most bands do. They were playing for 8 to 15 hours, 5 to 7 days per week for most of that 3 years. They had to develop material, and they practiced so much, they became outliers. They became better than the norm. Michael Jordan was a good athlete. There's lots of good athletes. He practiced, and became an outlier within the sports arena. And virtually every client that Best Performance Systems has worked with is an outlier. Now, why is a hospital or a nursing home that has worked with us now an outlier? Because they have far less injuries than every other facility in the area, because they have greater productivity from each person, because morale is better. People stay working there. They don't leave. They have a higher quality of patient care. They're outliers. And today I'm going to teach you exactly a major aspect of what we're doing so they became outliers, to make them outliers rather, and so you can do it yourself. But before we talk about the solution, let's discuss the problem. According to the U.S. Department of Labor, occupational injury incidents in healthcare accounted for 1 out of 5 incidents in all of private industry in 2010. In a study done by the Department of Labor from 1995 to 2004, nurses, nursing aides, orderlies, and attendants reported the 3rd highest number of injuries in all of private industry. Only truck drivers, laborers, and material handlers had more. And here's some very disturbing information. 80% of all caregivers have chronic pain, and 30% of caregivers leave the profession do so because of chronic pain. So what's our objective today? Very simple: to identify the specific stress in healthcare that leads to reduced productivity and injury, and to come up with solutions to reduce or eliminate that stress. Now here's an example of what we've done. The BPA system was implemented into a large nursing home in a desert town in California in March of 2007. Their work comp costs were annually approximately $800,000. And after we began to work with them with the things you're going to learn today, that reduced to $35,000 per year. And that result was maintained for 2008, 2009, 10, and 11, and still holding strong. Not only was the number of injuries reduced, but of those that did occur, the severity and their costs were greatly less. Plus, there was less litigation. Why? Because by treating people with respect, which we'll be discussing today, and it's a very simple thing to do, people, when they get injured, don't go and get a lawyer. And litigation tremendously increases the cost of the institution of injuries. Turnover decreased because people felt more respected. They were happier working there. And for those that don't realize this, when somebody leaves and has to be replaced, the cost of replacing them is 4 to 6 times their annual salary. And of course, morale and quality of patient care improved. So what are the benefits of eliminating stress? Well, the logical one, no pain. Work is easier and more pleasant for the caregiver. There'll be improved quality of patient care. Productivity rises. The healthcare worker not only has more energy while they're working, so work is easier, but when they go home, they have more energy. They don't use up all of their fuel, for want of a better expression, in order to get their job done. They go home with the energy to enjoy life outside of work. Their career is prolonged. They're able to prevent injury and disability. And for the institution, there's a tremendous reduction in work comp costs. Now how do people handle their injuries? They deal with them after they occur. They're spending their valuable time and money on expensive treatments to relieve pain. That may be privately with their own doctor, or that may be through the work comp system. But then what happens? People return to the exact same activities which caused the pain, caused the injury in the first place. Some people find ways to control that pain. Maybe they're resting and reducing their activities outside of work, taking medication, applying ice, seeing a chiropractor, getting massage, seeing physical therapists, even getting surgery. And some simply have a reduced quality of life and of work. Those are the people that are handling the injuries after they have already occurred. So there's a unique stress that healthcare workers are exposed to, and here it is. Many tasks in the healthcare environment involve prolonged and repetitive standing, leaning, and bending. The first thing in the morning, they start their shift, washing the patient, changing the patient, feeding the patient, performing a multitude of bed-based procedures. And what do all of these procedures have in common? They all involve spinal flexion. Spinal flexion, if it causes discomfort or not, makes your spine temporarily fragile and prone to injury from an otherwise innocent lift or activity. Now, why does it do this? Because when you're bending forward, when the spine is in a flexed state, the disc is being pushed to the rear. And because you're doing this for hours per day, year in and year out in your profession as a healthcare provider, eventually cumulative trauma causes the disc to be distorted, and it bulges out a bit to the rear, touching nerves, causing pain, or simply because it's bulging to the rear after that prolonged spinal flexion, it's then more prone to breakdown and injury during an otherwise normal lift. Well, what's another reason that spinal flexion can cause pain and a tendency to injury? Because when you're leaning forward, the muscles in your low back are holding you up. So from the prolonged contraction of those muscles, they become chronically tense. Here's the spine, and there are the normal curves. The neck is going forward, The upper back is going towards the rear, the low back goes forward, and the pelvis goes towards the rear. Those are your power postures. If you can work and maintain your spine in those postures, the muscles are relaxed and the discs are held in place, even if you have an extreme exertion. As long as you're maintaining those power curves of the spine, the discs stay in place. The problem is when you're improperly bending forward, here you see several vertebrae and the disc in between. And as you can see from leaning forward, that one disc is pushing towards the rear, touching the nerve. Now, that in itself could cause low back pain or even pain traveling into the legs, or simply from the disc being pushed out of its normal area when you then get up and perform some other lift or exertion. It's now prone to serious breakdown. So you also have muscle tension building up. When you're leaning forward to your patients, what's holding you up? The low back muscles, the gluteal muscles, and the hamstring muscles. And they become, from the constant contraction of holding you up while you're performing these activities, taking care of your patient in their beds, for example, the muscles become chronically tense. A typical problem that we see in caregivers is trigger points developing. The most common one of all is a trigger point in one of the gluteal muscles called the piriformis. A trigger point is basically a nodule of muscle spasm that encapsulates nerve endings. The trigger point in the picture you see on your right, you see it's up in the glute. But the entire green area going down the leg is where the person is going to feel the pain from it. We've seen, I was going to say dozens, but probably hundreds of patients over the years who have had severe back pain traveling into their leg. Many have even had disc surgery, which didn't relieve the problem at all. Upon evaluation, we find there's a trigger point in the piriformis. Simply deep tissue massage and a stretching program at home, and of course changing their techniques so they're not loading the gluteal region improperly, will eliminate that pain completely and permanently. It will eliminate it in as little as 1 week. So these various spinal flexion tasks are often followed by some lifting or exertion, as the patients are taken for medical procedures, hair appointments, exercise, bathing, etc. And the injuries occur during these innocent tasks. Why? Because from the prolonged flexion or spinal flexion that you had been doing, the disc could be bulging to the rear or the muscles could be tight. They're then fragile and prone to injury. Take a look at these discs. The disc on the left is a normal disc. The light blue area on the inside is gelatinous. The dark blue area around the disc are thousands of fibrous rings. The picture on the right shows an area where there is a weakness in those fibrous rings and the disc is able to bulge out. This is the most common injury that will cause low back pain, which will often travel into the leg in the caregiver. The serious $100,000 to $200,000 injury is this. The picture on the left shows a normal disc. The picture on the right shows where the breakdown had occurred and the gelatinous center completely broke through. Only surgery will relieve the pain for this patient. And this is life-altering for the caregiver and extremely expensive for the institution. And it's completely preventable. So what's the solution for these unique stresses? It's a three-part solution. The caregivers must learn to stand, bend, and lean with a technique that will minimize stress in the low back to the muscles and will minimize disc distortion, which you're about to learn. Then, after the activity, even if you use good techniques, there's still some flexion taking place. After the activity and before the lift, apply a 3-second stretch to eliminate the stress caused by spinal flexion. In a moment, you're going to learn how to diagnose which ones you need to do, and if your discomfort is being caused by muscle tension or disc distortion, and how to get instant gratification. And the third thing is the caregivers must be influenced to always use the best, safest, and most efficient working technique. Okay, let's talk about standing, bending, and leaning with a technique that will minimize stress and minimize disc distortion. Stressful way that most people stand is the following, and as many people that are listening to this webinar as possible, I'd like you to try this. I want you to stand with your feet next to each other, as people normally do when they're working, and lean forward and reach out to an imaginary patient. Hold that position as you do when you're working with a patient. Where do you feel the stress? I can hear you right across my computer. You feel it in your back. Now, let's talk about the best way to stand. Stay right where you are, and instead I want you to have a staggered stance. Have 1 foot forward and 1 foot back. Have your knees slightly bent, and now lean forward to the same imaginary patient. Hold that position as you do when you're working. Where do you feel the stress now? Yes, I can hear you loud and clear over the computer. You feel it more in your legs. Your back has far less stress. The reason being, when you stand and your feet are together and you lean forward, all of the bending is taking place in the lumbar spine. The muscles are loading in the lumbar spine, glutes and hamstring, and the disc is being pushed to the rear. But if you have a staggered stance, 1 foot forward, 1 foot back, and you bend your knees and then you lean forward, you're bending where the leg joins the pelvis, and you're not getting spinal flexion in the lumbar spine. If you were to hang up and leave this webinar right now, just that one fact that I just shared with you, that one technique will change how you feel when you're working for the rest of your life in a very positive way. So the principles of best standing are: have a staggered stance, the knees slightly bent, move and change positions often. Any posture which you hold continuously will become stressful, and have 1 foot up when you can. This is if you're leaning forward, feeding a patient, changing the patient, performing any kind of a bed-based or chair-based procedure where you have to lean to the patient. The leg position is an incredibly powerful tool when you know this trick. Here's what I'd like you to do. There's a multitude of activities when you're working with the patient where you must apply pressure with your hands and your arms to move the patient about or to manipulate some object while you're working with the patient. When you're leaning to your patient, have 1 foot to the rear and have the toe of the rear foot pointed in the direction of the force being applied by your hands. If you stand with your feet together, lean to your patient, and apply force with your arms, all the work is being done by your arms, your shoulders, and your back. But if you put one leg back, and I would invite any of you to stand up and try this right now. If you put one leg back with the toe of the foot in the rear pointing the same direction as your hands applying force, 85% of the force being applied by your arms is being generated by your leg. Therefore, you have far, far less stress being applied to your shoulders and your back, and you have much more force to be able to provide quality care to the patient, to be more specific, more exacting in whatever it is that you're doing with the patient. Each time your arms change the direction of their pressure, change the foot position a little bit. And all you need to change is the direction that the toes are pointing. When you're pointing directly in front of you, the toes are pointed the direction your hands are moving. If you have to change and you're now pushing 30 degrees to the left, you simply change that back foot so that rear toe is staying with the pointing in the direction that the hands are applying pressure. Another great technique that's going to make work easier for you, make you far more effective. Let's go to the next step of the solution. After you've been doing some job where you've been standing and leaning, even with the best technique, there's some stress to your body. Before the lift, apply a 3-second stretch to eliminate the stress caused by spinal flexion. So, let's talk about self-treatment of the low back. Let's talk about eliminating the stress caused by leaning forward. Here's a simple stretch that you can do, and you only hold it for 3 breaths, which is approximately 3 seconds. This can be done sitting, as that picture shows you now, or it can be done standing. Simply lean against the wall or lean against some solid furniture. You pull your knee up into your chest. You may feel this in the hamstring or the glute or the low back. You're going to feel it where you have tension. And when you pull your knee up into your chest, bring it over across your body and pull it in. Bring it straight towards your body. Take it to the knee to the outside and pull it in. Of these three positions, whichever position you felt the most tension somewhere in your leg, buttocks, or low back, hold that for 3 relaxing breaths. Then do the other leg. The other thing that will reduce discomfort immediately and will prevent you from getting injured is to reset the disc. You can do this sitting or standing as this picture shows you. You stand or sit, put your hands in your low back, push into your low back and stick your belly out and your chest goes up. Hold that for 3 breaths. This is pinching the disc in the rear. If the disc was bulging to the rear, again, a very common situation in healthcare workers, this is going to pinch it to push that distorted disc tissue away from the nerves and back in with the rest of the disc tissue where it belongs. Now, how do you know which one's the important one for you to do? It's quite simple. The one that relieves your discomfort. If the tension or fatigue or discomfort in your low back is being caused by muscle tension, the knee pull will take away your pain instantly. If the discomfort is being caused by a disc distortion, the back extension will take away the discomfort instantly. It's as simple as that. If you're simply doing this to prevent injury and you have no discomfort, after one patient, you might do the knee pull. After the next patient, you might do the disc distortion. Do these throughout the day. They only take 3 seconds. In the hospitals, nursing homes that we work with, we reward the caregivers for doing stretches 2 to 4 times per hour. And again, these stretches take only 3 seconds. And for those supervisors that are worried about people not working and stretching instead, productivity goes up significantly because people feel so much better. Final step for the solution for this unique stress in caregivers. Always use the best and most efficient working technique. Now, there's just too many patient transfer and manipulation techniques to present in this form. That alone could be a 2-day seminar. So instead, we're going to share some basic concepts which can be applied to almost any technique. A problem that we see in so many of the nursing homes and hospitals we worked with is the facility has purchased mechanical lifts, but nobody can ever find them because they're sitting in a closet somewhere. And when we interview and survey the workers to find out why they're not using the lifts, the number one reason they're not using them is because they can't find a sling when they need it. The solution is to simply have the facility buy a box of slings. And for those patients that need a mechanical lift due to their medical condition, obesity, being non-responsive, that patient will have a sling left in their room. So when it's needed, all you need to do is go and get the mechanical lift, and it's right there for you to use. In many situations, the caregivers will actually put the sling under the patient and leave it there for the day. So then when they have to manipulate the patient, they simply bring the mechanical lift, attach it, and they're able to lift the patient and take care of them. Here are 3 techniques that will reduce the stress on your body when you're taking care of patients, utilizing the legs. You want to maximize your legs and arms doing the work at all times and minimize the use of your spine doing the work at all times. Technique 1. Whenever you're working on a patient, we see it all the time. A caregiver will stand with 6 inches between themselves and the bed, and they're leaning into the patient who's in the bed. Get as close as you can to the patient and put 1 foot under the patient as close as you possibly can. Then when you need to manipulate the patient, that leg, because it's under the patient, is going to assist you in lifting the patient. If your feet are together and you're leaning into the patient when you need to lift them, 100% of the work is being done by your low back and shoulders. You're in danger of getting injured. You're going to get fatigued. You're going to feel discomfort. Simply put one foot under the patient, and that front leg now is a major part of the power to lift and manipulate the patient. Now, this next technique is going to seem like a complete contradiction of what I just told you. Another technique, when you have to lean into a patient, if you are not able to get a foot under the patient, you can put one foot to the rear. Just like I told you with the standing technique earlier, if your feet are together and you lean to a patient to lift them, all the work's being done by the lumbar spine. But if you put one foot to the rear and bend your legs and lean into the patient, you're actually bending where the leg joins the pelvis, so you're minimizing work being done by the low back. It seems like a contradiction. To protect the low back, you can put one foot forward under the patient to lift them, or you can put one foot to the rear so you don't have as much work being done by the lumbar spine when you're doing the lifting. Both techniques work. I implore you, give them both a try, and you're going to be shocked at how much easier it's going to be on your body and how much easier it's going to be to deliver quality care to taking care of that patient. One last thing. We've seen this hundreds of times. The caregiver will stand with their feet together, they'll lean in to move a patient, and they move them, and their feet never move whatsoever, and their feet are together. Instead, have one foot close to the beginning of the movement and one foot close to the destination of the movement. Now, when you go to move the patient, you're still using your arms, you're still using your shoulder, even your back, but the leg shift contributes most of the power to moving the patient. Now remember, all these techniques that we're teaching you today are rules that are firmly carved in wet clay, not in granite. So you'll apply these when possible. But every time you do, you're reducing the stress on your body and reducing the fatigue that you're going to experience. For long, difficult, or awkward moves, do not try one continuous movement. This is what we see most caregivers do. They'll set themselves up to move a patient, and they'll be in a good power position. So when they start moving, the work is being done by the arms and the legs, but they try to move the patient in one continuous movement all the way to where they have to go, and at one point in the middle or towards the end of this movement, they're now loading their low back. Instead, perform a difficult or awkward move. Instead of in one continuous movement, do it in a series of small movements, repositioning each time to maximize your leg and arm power and minimize your trunk working to move the patient. Now, many of these things are common sense. Many of these things some of you are already doing some of the time. What we want to do is influence you and your staff to use the safest technique, the most efficient technique, all of the time, so you prevent discomfort, fatigue, and injury. Something else that we find many caregivers don't do is they start their shift, they go into work on a patient, and they're surprised because they didn't know the situation with the patient. Research your patients. Make sure that when you have your pre-shift meeting with the previous shift, that you discuss not just their health condition, but also discuss, does the patient have strength in both arms or only one arm? If not, if you know which arm is good, you can then work with the patient in such a way that they can use their good arm to assist you. Find out, is the patient cooperative and can they comprehend instructions? You need to know these things in advance. Is there a history of unexpected or combative behavior? Don't find out when they lash out at you. You should know already to be prepared for that. How heavy is the patient? Sometimes looking at them really doesn't tell you. Does the patient have any painful conditions you need to be careful of, that you need to consider when moving or manipulating the patient? And also, have they had any recent surgeries, paralysis or partial paralysis, instability in their spine, vertigo, etc.? There are actions of you, the caregiver, the healthcare worker, that will make taking care of the patient much more effective, and much safer on your body. We frequently find caregivers simply go in to work on the patient, to move them, and they just start moving the patient around. They don't tell them exactly what they're going to do in advance. Tell the patient what you're about to do and all the steps. Get their permission. If you say, is that okay with you, after you tell them what you're about to do, now they're going to be more cooperative. We frequently see caregivers not doing this, so the patient doesn't know what's going on. They then become uncooperative because they don't know what to expect, and they're afraid. This seems obvious. Always lock the wheels. We have seen gurneys and wheelchairs go flying away over and over again while being transferred between the object, the moving object, and the bed. Take the time to lock the wheels every time. Are the are the chair arms movable or removable? We've seen people have to move a patient from a bed or a commode into a wheelchair, and they're doing battle with the arms when, if they had looked, they swiveled out or they easily were removable. Take the time to know this, and take the time to remove them, if that will facilitate taking care of the patient safely for the patient and safely for you, the caregiver. Use gravity. If the patient has to be moved up in bed, adjust the Trendelenburg so you're now taking the patient down a slope. We frequently find that facilities will have this, the beds will have the ability to tilt, and they'll go for months, even years, not being used. And the caregivers are complaining of chronic pain. They have too many injuries. They're complaining how hard their work is. This will make your work tremendously easy. Take advantage of the technology that exists in the equipment that you already have. Look up during the actual lift. Think about an Olympic weightlifter. An Olympic weightlifter stands at their weight, they bend down, they set their body, and right before they do the lift, they look up. If you do everything right in your body posture, but you're looking down during the lift, you can still bend and use your back. But if during the actual lift you simply look up, that will set those power curves in the spine that I talked about earlier and will protect your back. Simply look up during the actual exertion, and that will help to save you, save your back. If you're moving the patient up in the bed, have them flex their knees and ask them to help and push up on an announced count. Very obvious. Many of you are doing this. Many of you are simply struggling to carry the dead weight of the patient. Stay as close to the patient as possible at all times. What some caregivers will do is they'll carry a towel with them if for some reason they don't want to touch the bedding, the table directly. They'll simply drape it so they can get up against the bed, for example. You want to be as close as possible to protect your back. If there's 1 inch of air and light between you and the surface the patient is lying on, then your back is doing tremendous work it doesn't have to do. So you want to be as close as possible to the patient and be in contact with the surface which they're lying on. Move your feet during the transfer or a wide stance in the direction of patient movement. We talked about that a little bit earlier already. Never, ever twist with a load. This is the most destructive thing that you can do to your disc. And once a disc is injured, you have a problem forever. You can do something wrong 1,000 times and have no problems. And you think, oh, that technique works fine for me, even though everybody says it's wrong. And then one day you do some innocent thing. We had a large orderly that we trained. He had been working in the hospital for close to 20 years. Never had a back injury his entire life. Somebody asked him to pick something up and it weighed only 10 pounds. He bent down to pick it up. His back locked. He was stuck in that position for 8 days. That was 5 years ago. He's had chronic back pain ever since that moment. He never had a problem before picking up that object. Was picking up that object the cause of his injury? No way. It was the way he used his body, pain-free, symptom-free, but incorrectly for many years before that. So it's important that every caregiver knows proper technique and applies it even when they feel good, because most injuries in healthcare workers occur doing something that you have done hundreds or thousands of times before. It's cumulative trauma that built up over time, and that final straw that broke something is when the pain begins. And when it's a spinal injury, you'll now have a chronic recurring problem for the rest of your life in most cases. Place the receiving surface lower. We've seen people take in a gurney to a bed and remove the patient from the bed to the gurney, and the gurney is higher than the bed. They don't lower it or raise the bed. Always, when possible, set the receiving surface for the patient lower than the surface they're coming from. Again, these are things that many of you know. We want to influence all caregivers to apply these techniques all the time. Our experience, Northern and Southern California, East Coast and West Coast, is this is not done on a consistent basis in healthcare facilities. And use a lateral slide or friction-reducing device when moving the patient, or even just a sheet. Big problem, upper back stress. How many of you listening to this webinar sometimes get a well-localized burning or stabbing or aching pain between the shoulder blades, or you have some kind of stress in your shoulders and tension and fatigue, or your arms just plain feel heavy? Well, if your shoulders are tense and your arms feel heavy, do shoulder rolls. Everybody, I want you to do this with me. I want you to do 3 shoulder rolls in one direction. Now look down at your shoulders. Oh, I can guarantee, even though I cannot see you, almost every one of you, you're going up, you're going back, you're going down. Then up, then back, and then down. And the reason you're doing this is because you have so much tension in your upper back. We see this in hundreds of workshops we've taught with healthcare workers. So let's do this again, but this time I want you to go up and back and down and forward. Up, back, down, and forward. Do 3 big shoulder rolls in one direction, then 3 big shoulder rolls in the other direction. That little technique will tremendously increase the strength in your arms. Because in those days when your arms feel really heavy and feel weak, they're not weak because they're tired, they're weak because they're tense. And this simple technique, what you can do as you're walking down the hallway, will decrease the tension and increase the strength in your arms. Now that well-localized burning or stabbing or aching between the shoulder blades, it's from working with your shoulder, with your upper back bent forward. Not your neck bent forward or your lower back bent forward, but the upper back slumping and bent forward. It pushes a disc to the rear between the shoulder blades. That's what's causing this well-localized burning, stabbing, or aching between the shoulder blades. The solution? There's the stretch. Put your hands together behind your back. Everyone try this. Stand up. Clasp your hands together behind your back. Straighten out your arms and raise your arms up in the back and simultaneously the chest up in the front. And hold that for 3 relaxing breaths. If you had that burning, stabbing, or aching pain between the shoulder blades, it's now gone, because this will instantly pinch the disc in the rear, pushing that disc away from the nerve and back in where it belongs with the rest of the disc tissue. If you get this pain once in a while, this 3-second stretch is something you should do a few times throughout the day so you don't wind up having that pain at all. If you have the pain, simply do the stretch, it will take it away instantly. As far as technique, you need to look at how you are working with your patients and make sure that you're not slumping in the upper back when you're working with them. Another culprit here is the long hours that many of you spend charting, and you're sitting at a desk and you're slumping forward at the upper back. Make sure you're working with your chest up so you keep that disc in place between the shoulder blades. Now, many of you get an ache or cramping in the shoulder blades themselves. The upper back on the 2 sides, the shoulder blades, you get ache or cramping. That's the rotator cuff muscles. Typical area of chronic tension and therefore weakness in a caregiver. The solution? There's a simple stretch. Put one arm across your body. Everybody do this right now. Put one arm across your body and grasp the elbow. Now when you go to stretch it, Drop the elbow down low and pull across. Now drop the elbow up in the middle and pull across. Now bring the elbow up to the level of your chin or your mouth and pull across. On every one of you, one of those positions was tighter. That's where you're going to hold it. You have now identified the exact site of your rotator cuff tension. Simply holding it for 3 seconds will relax it, which will both decrease discomfort and give you tremendous increased strength in the shoulders for performing your job. Of course, do both sides, and you'll be amazed how many of you are going to find it's different on each side. Now, the most typical cause in healthcare workers of chronic rotator cuff tension and weakness is an imbalance. The chest muscles are stronger than the upper back muscles. The next time you're out around the facility, I want you to look at other workers and see how many workers, when they stand, they carry their shoulders forward of neutral. They're not slumping, but they carry the shoulders forward of neutral. That indicates that they have the strength imbalance. Look at yourself in the mirror. If you have it, that means your chest muscles are stronger than the upper back muscles, so they're overpowering them. The upper back muscles, since they're always being overpowered and stretched out, work to not be overpowered. They become chronically tense. That's why so many of you get aches in your shoulder blades and get an ache in the upper shoulders and go home with a headache at the base of your skull. That's a muscle contraction headache caused by tension in these muscles. The solution, the permanent solution, is to strengthen the upper back muscles. I didn't include that strengthening program in this webinar, so please email me and ask me for the upper back strengthening program. I have it printed up with pictures on a single sheet. It's a 2-minute routine which you can do at home 3 times per week, which within 1 month will balance the front and back of your upper body and eliminate that discomfort in your shoulder blades, in your upper shoulders, and probably will eliminate that headache at the base of your skull that many of you get by the end of the workday. You sit a lot. You sit while you're working with patients sometimes, when you're feeding patients, when you're performing certain procedures. You sit while you're doing charting. When you're sitting, put your buttocks to the back of the chair. Arch your low back. Put your hand back and feel where the deepest part of your curve is. That's your low back curve. Place support in that curve. I don't care if you buy a lumbar pillow, if the chair has something built into it, or if you just stick a rolled up towel. If you're in a restaurant, a rolled up sweatshirt. You got a water bottle, like an Arrowhead or a Crystal Geyser water bottle. Anything to support the curve of your low back. And this can change from week to week. If you go out and play volleyball for the first time in 2 years, on Monday, you're going to have more tension. That will change the location of your low back curve. If you're relaxed and go to a spa for the weekend and get a massage and do yoga, that's going to change where the curve is also. So when you sit down, just quickly stick out your belly, arch your back, feel where the deepest part of your curve is. That's where you place your support. You've now customized the ergonomics of your sitting. Now, here's another problem. Many of you, when you work, when you sit, you don't sit back. You like to sit forward. When you must lean forward, if your chair has the ability, tilt the seat pan forward. That will maintain the lumbar curve. If you're sitting forward in your chair, like many of you find most comfortable, then your back is going to fall out the wrong direction. The disc bulge out, the muscles get tense, your head gets forward, the head tension builds up. If you roll your pelvis forward by simply sitting on a teeted seat pan, that maintains the curve in your low back, and it will also put your head above your body. Now, if you don't have a chair that does that, you can sit on a small wedge. It's a foam wedge. If you don't know where to get this locally, again, you can email me, and I will send you the company that we work with that sells them. They're only a couple of dollars. And this alone can make a tremendous difference, because a lot of the stress in the low back and shoulders of healthcare workers is from sitting and the hours that you're doing your charting. It creates tension, and then you go hurt yourself when you go work with your patients. When you're working with a patient and you're sitting, if you tuck your feet under the chair and lean to the patient, all the work to hold your upper body up is being done by your low back. Simply put one foot close to the patient or close to the working area when you lean forward. Now that leg's going to hold you up. Simply try it. Sit and tuck your feet under your chair and lean forward. You feel it in your low back within moments. Now just put one foot on the floor under the area you're leaning towards and working, and immediately you can feel how your back is no longer under stress. When you lean forward and you're sitting, keep your chest high so you're leaning forward at the hips. If you let your upper body slump when you lean forward, you're bending your low back. If you keep your chest high and you lean forward, you're bending at your hips and you're protecting the spine in the low back. In this picture, you can see somebody, she's sitting there relaxed without low back support. The only difference in the next picture is we put something in her low back. The lumbar curve is being supported, the discs are in place, the muscles are relaxed. Notice her head and shoulder position. Simply by putting something in the curve of her low back, her head and shoulders are above her body, so they're more relaxed also. I can't stress enough that you should never, ever sit without having something in the curve of your low back. And in the hospital setting, if you don't have a pillow, simply go grab a clean towel and roll it up and stick it into your low back. Some additional strategies. Maintain hydration, drink water. When we work at the hospital nursing home, when we do our surveys, it's shocking how many caregivers never drink water throughout the day. What do you drink? That's right, sodas and coffee all day long, which will quench your thirst when you drink them down and make you more dehydrated. Dehydration causes fatigue. Dehydration increases inflammation and muscle spasm in the body. I can't stress enough, you must drink water. If you want to be healthy, you need to be hydrated. Maintain blood sugar. When you take breaks, eat something. And I know you love a nice, sugary, delicious treat, but how do you feel when you first eat a delicious treat, a sugary treat? You feel great, don't you? How do you feel 20 minutes later? That's right. You're exhausted because your blood sugar spiked and went down. You need to maintain your blood sugar while you're working. If your blood sugar is low, you're fatigued, you're exhausted, work is difficult, you're not going to be as effective, and you're more prone to injury. Eat at all your breaks, have some kind of a healthy snack there. Goes without saying, don't be exhausted, get sufficient sleep. You have one of the more difficult jobs that exist in the Western world. Being a caregiver in a nursing home or a hospital is extremely demanding work. You're like an industrial athlete. You need to be conditioned. You need to have enough sleep. Because your job is so hard, you have to have some type of physical fitness. If you don't exercise at all, just go for a walk. But there's a multitude of exercise programs. Take 10 minutes that you can purchase in any bookstore that you can learn. A 10-minute routine done 3 times per week will make a tremendous difference in your body's conditioning and your ability to perform all the physical demands you do as a caregiver. If there's a particular task that you perform which is very difficult for you, it's a real strain, get a piece of rubber tubing and reproduce the body mechanics of that activity 3 times per week. How do you do it? You simply take a piece of rubber tubing, a bungee cord is readily accessible, and do 15 reps in slow motion with your body reproducing that activity. You should be fatigued after 15 reps. If you don't, the next time make it tighter. If it's easy to finish, you can keep on going. Rather, if you get fatigued, make it looser next time. If it's too easy to finish, make it a little tighter next time. But 3 times per week, this will take less than a minute, will make a tremendous difference at your taking control of your body by making yourself conditioned to perform the tasks that you already find difficult. Now, ready for this? I have a training company. We do training. And here's a statement. Most training is an absolute waste of time. Why? Because the new skills and your new equipment are worthless if your workers don't actually apply them. So, how do you get workers to apply them? It's easy to get workers to use the best possible technique when you're right there telling them what to do. But the goal is to influence them to work safe and efficient and use both equipment properly and technique properly when you're not there. So, how will you influence your caregivers to want to change to a better technique when you're not there, even at home? Workers can be influenced to change to the best habits easily. The necessary elements are behavior modification training. This is a technique of training where they think it's their idea. Accelerated learning techniques. My mentor for accelerated learning techniques is Sarah Nouri Singer, Nourisinger. Her book is Quantum Teaching, and she has techniques where when you they're very simple. They actually are fun techniques for the audience, for whoever you're teaching. They will understand and they will remember long term what you've taught them by applying these simple techniques. If you're going to teach workers a new system of using their body, if you want them to buy into it, you need to involve them in the development of it. They must have some kind of ownership in order for them to buy into it. No one likes to be told what to do. If you want them to feel respected and receptive to what you're teaching, let them be involved in the development of it. There must be some kind of simple, easy, non-time demanding, a systematic, daily positive reinforcement reminders of good technique. Remember that one facility that dropped their injuries from $800,000 per year to $35,000 per year. Part of what they have are daily positive reinforcement reminders. And for the supervisors, who are the ones to do this, it takes only 3 minutes of their time per day, added up throughout the day. There must be positive communication between workers and the supervisors. We have one nursing home that we work with. They're in a high desert town in California. 2 facilities in the same town. They're owned by the same people. They draw their patients from the same population. They draw their employees from the same population. One of them has very, very, very low injuries, much lower than the industry average in California. The other one has double, even triple the injuries. Their worker comp costs are through the roof. The difference is the management style, the way that supervisors and management speak to the workers. There's a simple system of positive communication between workers and supervisors so the workers feel respected. It actually will take less time of the supervisors to use these techniques, and the workers will be much more cooperative and even will be involved in trying to help the department to run more efficiently. All of this will be the subject of the next webinar on injury prevention and performance enhancement in healthcare. This is the stretching card which we use for healthcare workers. We've already taught you today several of these stretches. The shoulder rolls, the chest extension, the cross chest stretch, the back extension, and the knee pull. If you would like one of these laminated cards, again, email us and we're happy to send them to you. Also, we're teaching you today just a very small part of what we do. We taught this as an 8-hour seminar at the National Ergonomics Conference several years ago, and a transcript of our entire system and how to apply it is available. Again, feel free to email us if you would like a copy of that. Let's take a look at your questions now. Let me set this up. I'll just be a moment. I see no questions here. Does anybody have any questions? I'm going to open up the line for those on the telephone, or you can type in any questions that you have. Does anybody have any questions on the line? Okay. We're going to be signing off. Thank you for joining us for our webinar, and we look forward. Hold on one second. We do have one more thing to share with you. Okay, the webinar is on demand. All of our webinars can be accessed by the link found on the website, www.bestperformancesystems.com, or the link in the original invitation to this event which you received. If you would like the laminated stretch card, the integrated system seminar notes which I referred to, or a copy of the exercise program for strengthening the upper back, you can simply email me, and that's Barry@bestperformancesystems.com. Again, thank you very much for joining us for our webinar, and we look forward to speaking with you again in future webinars.